Okay, so we're doing the order sets. So the order sets, when you need to place a lab order, so they are on here on the order sets. Okay, so you have all those order sets now, and you pick the one that you want to use. Like, let's say if this is patient, we accept patient's insurance, so we do labs in house. So there are several like we use primarily two order sets: universal order sets 2 days and 3 months. The difference is that if you order the blood test now today, you use this one. If you order it, let's say patient comes in 3 months, you order it in 3 months. Let's say patient has to have labs done in a month or in 6 months. You can use either of those. You just have to change the date in it. Let me show you how to do this. Otherwise, they are identical. So you click here on those letters, OS next to that. You have to select the diagnosis from your list, any diagnosis. Okay, so now this is, you dismiss this. Okay, so this is the order sets, and it has different panels. It has different panels that you can select. So patients who, like diabetic patients, who usually, or patients with even borderline diabetes or pre-diabetes, if we want to check hemoglobin A1C, we use CV risk, cardiovascular risk profile. And if you hover your mouse over it, it will show you the individual components in that yellow line. So what's included, so that you know. But after a few times you do it, so you know by heart what's in there. So this is for female, this is for male, because testosterone is included here. Testosterone with reflex to FSH and LH. If testosterone is low, the lab runs the test, so we can see. That's the only difference between them. Why there's 1 and 2? Some insurances, they don't pay for certain things, so we use this one for Medicare, number 1, and for non-Medicare we use 2. Now, thyroid. Those are for patients who don't have diabetes or pre-diabetes. So the difference between this panel and this panel is this panel does not have thyroid, does not have A1C, urinalysis, microalbumin, A1C, insulin C-peptide level. It does not have it. It has other things like cholesterols, chemistries, thyroid. And the same thing, thyroid complete 1 and thyroid complete 2. The difference is thyroid complete 2 and CV risk 2 includes total T3, which Medicare does not cover, so we separated it. So the next 2, it says thyroid without antibodies. So the difference between thyroid complete and thyroid without antibodies is that thyroid complete has thyroid peroxidase and thyroglobulin antibodies, and you can see them in the end. So this one does not have it. So patients who have like Hashimoto's thyroiditis, we check it like maybe not every time, but every other time to see if titers changes. Some people are very nervous about antibodies. They want to check them every time. They would ask you every time. So then we have thyroid limited. Thyroid limited has only CBC, CMP, and thyroid function tests. Thyroid limited 1 and 2. This one has total T3. This one does not. This one we order, let's say we change the dose of levothyroxine, and we want to repeat the blood test not in 3 months when we check everything, but in 6 weeks, 4 weeks. This is when we order this. Down there you have individual tests. So those are just the thyroid antibodies. This is the test called thyroid cancer monitoring. We should probably talk about this separately when it comes to that. Like, when do we order this test? We don't always order it for a patient with thyroid cancer. Sometimes we do, sometimes we don't, but we'll cover it separately. So then other panels, you have female hormonal panel and male hormonal panel. So this is if, let's say, a woman with irregular periods, or if you want to see if the woman is postmenopausal or not. So then you can order this test, female hormone. Male hormonal panel is, again, when we evaluate for low testosterone, but it's also part of CV profile. So if, let's say, you don't order CV profile, this is not a diabetic patient, but you want to also check for like low testosterone, you can include this, or you can include this test. It's called testosterone with reflex to like other tests, to prolactin, FSH, LH, and SHBG. SHBG is a sex hormone binding globulin because sometimes testosterone is affected by that, especially in obese people. Yeah. So then we have individual tests and some other small panels, so you can just go through them later yourself and see if you need to order some individual tests. So sometimes, like let's say, want to check like prolactin or insulin level on a non-diabetic patient, so then you order, let's say, thyroid panel, and you order this. Okay, let's say you ordered CV profile male, and also patient has hypothyroidism. You order antibodies because they are not part of this. You order antibodies. And patients has, let's say, osteoporosis, so you check PTH like every 6 months or so. This, if patients have osteoporosis, okay, you mark this, click this. So then you click here. It says order selected. Now, see, it says 2D. It means that 2 days. For some reason, there's no option to select today. So we put 2 days. Now, if you want to do it, let's say in a month, then you can change it. So you click here, and then you select the appropriate, like let's say 4 weeks. 4 weeks, and click OK, and it changes to 4 weeks. But then you have to do it like for every test that you mark, 4 weeks and 4 weeks. So this, so we have 2 sets like that. One is for now, and one is in 3 months. But if it's, let's say, if it's in let's say patient, you do it in 4 months, you don't really need to change 3 to 4 months because it's pretty close. This is the only purpose of this, like the timing here, is just for a medical assistant to get an idea whether this is the current order or like past or future order. And I usually don't put more than 1 order at a time. Like let's say I want to order labs in a month, like brief order, and in 3 months before the next appointment. I don't put 2 orders because they can mess up. So when patient, I will put only the next order in 4 weeks, and when I get the results, then I will put another order. Okay, so now we close it. Now we close it. You don't see it because sometimes you need to refresh, so you can just click here. What's going on? Yeah, I guess it's when I clicked on selected, maybe it didn't work. Okay, so we'll do, well, you know what could be the reason? So you have to have a diagnosis here. I know we selected when we clicked on the order set, but let's do this. So at least one diagnosis should be in chart. Yeah, so it's in chart. Okay, now let's do it again. So we go to order sets, we select, now let's select this one, 3 months. Yeah, I don't know why it shows this. I don't know which one you need to click. I think I have it differently. Okay, dismiss. So let's say I put this one and this one and this one. So I click order selected, and then you have to see. Okay, so now they're here. Okay, so now you have all the orders. So now in the next appointment you can type like follow-up 3 months, labs before. This is for a front desk to see. You just type. Of course you can click like select this, but I don't use this because first of all when you click you don't see that it's here, although it's here. So if you click OK now, you'll see that it's here, 3 months. But I just type it because it's easier to type and say labs before. Also, like one of the things, so if you put a comma here, it will, like let's say you type something and you put comma. If you put comma, it's already kind of like here. You can delete it, but it's here. So, but if you don't want to, and the front desk will see it. But if you want to type the whole thing, you have to use like semicolon. If you use semicolon, it's not going to happen. So you can put like semicolon, and you can do this. But as soon as you put comma, so then it becomes like this. And then if you click OK, so it stays here. But you can delete it. If you click again here, so you can just delete them. Yeah. So that's how you put the lab order. There's another, I think, yeah, let's stop here.